Good, happy Thursday afternoon, everyone. I'm Riley King, and welcome to this afternoon edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this afternoon, so let's begin. First up, COVID-19 in New Hampshire, what you need to know. And here is the information on what you need to know. There are 415 number of people in New Hampshire who have tested positive for COVID-19. 962,977 number of people worldwide who have tested positive. 4 number of deaths from COVID-19 in New Hampshire. 58 number of people hospitalized with COVID-19 in New Hampshire. 5,148 number of deaths from COVID-19 in the United States. And in this map here, it breaks down each town and community that have cases of COVID-19. For example, Nashua, 40 cases. If you want to see that map, we will share this link with you after the broadcast. New cases each day in New Hampshire. In the purple are daily new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are deaths. Only 4 deaths have been reported in New Hampshire. And the common symptoms: fever, cough, and difficult breathing. How it spreads. And prevention tips. Again, stay with the Riley King Network with the latest COVID-19 information. 11.7 million in new federal COVID-19 response funds, mostly directed at communities. Additional grants for settlements include 7.5 million in block grants, 3.8 million for emergency shelters. A third round of federal funding is headed to New Hampshire's way for the $2 trillion settlement package known as the CARES Act, which passed Congress and was signed into law last week. The state's congressional delegation will announce later Thursday that 11.7 million can be used by local cities and towns for a variety of needs, as well as for emergency shelters to prevent homelessness for a cross-section of Granite Staters, and specific location to address low-income people with HIV/AIDS. One new death in New Hampshire attributed to COVID-19. Other deaths could be linked, officials say. More deaths, hospitalizations investigated as possible cases of COVID-19. Let's take a listen to that video from WR News 9.
Out the door when it matters most. For more than a decade, he's been right there, everywhere. And when American jobs are on the line, he leads the charge. ABC's World News Tonight with David Muir is America's most watched newscast, and we thank you.
Governor Chris Sununu says the next month will be a challenge unlike anything we've seen, but that New Hampshire is up to the task.
There will be an end to this, and we will get back on our feet and be very resilient as we always have been.
In total, the state now has 415 identified cases of coronavirus and 4 deaths. 91 have recovered. The numbers will grow in the coming weeks.
We believe COVID-19 is widespread and present in most communities throughout our state.
During today's press briefing, state health leaders said the virus is now impacting long-term care facilities, but they wouldn't say how many.
We're going to see outbreaks and clusters of illness in facilities, and we're going to do our best to work with those facilities to try and minimize the impact
The peak likely is still weeks away. Sununu says the state has 2,000 to 3,000 additional beds and is ready to handle a surge in patients. FEMA recently made 3 shipments of equipment for medical workers.
Right now, and at least over the next few weeks, we feel very comfortable where we are with PPE. What we're relying on now is the commercial market, right? We've put in these commercial orders, both the state has, hospitals have.
State leaders urging everyone to be patient and continue to stay away from others.
COVID-19 is going to be with us for likely many more weeks, possibly on the order of months.
14% of those with COVID-19 have been hospitalized here in New Hampshire, but health officials are investigating more hospitalizations and deaths as being possible COVID cases. Reporting live in Concord, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. COVID-19 patients at DHMC given antiviral drug with clinical trial underway. Doctors hopeful that the antiviral drug will help. Let's take a listen to that video from WMUR News 9, Kristen Carosa.
A team of researchers at Dartmouth-Hitchcock Medical Center are working with more than 90 other clinical sites around the world to research a medication called remdesivir.
It was our priority, and we worked straight 8 days on the study to make sure it was going to open as fast as we could get it to open so that we could have it as an option for our patients.
Researchers say the antiviral drug was developed during the Ebola outbreak and has potential to help patients battling COVID-19.
They're really very limited treatment options, and this is the most promising treatment option identified by the World Health Organization.
25 nurses are now giving the medication to patients who have tested positive for the virus. The goal is to evaluate the effectiveness of the drug in patients with moderate and severe COVID-19 disease.
I'm hopeful that within the next few weeks we're going to have some preliminary results so that Gilead can start analyzing the data and making decisions with the FDA, of course, about whether or not this medication will be made available for the general public.
Now, we did ask doctors about how many patients are receiving this medication, but they couldn't tell us at this time. Live from the newsroom, Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. Dow jumps more than 100 points after Trump tells CNBC Saudi and Russia will ease oil pressure. Stocks rose in volatile trading Thursday as oil prices jumped on expectations Saudi Arabia and Russia will ease the pressure off the oil market. Breaking record 6.6 million unemployment claims filed in 1 week, surpassing the previous week's record-breaking number of 3.3 million claims. And, some health and, lesson for today. Today is Wear Blue, World Autism Awareness Day, and show your support for the autism community by wearing blue today. All of us at the Riley King Network are wearing the color blue to show the support. And what is autism spectrum disorder? Let's take a listen to this video from Discover Children's. And April is Autism Awareness Month.
April is Autism Awareness Month. We are here with Dr. Steve Pasternak of Spectrum Health Medical Group. And so let's talk about autism and what it is.
I think the first thing to keep in mind is that autism is a spectrum disorder, which means it varies in its symptoms and how kids maybe show signs of autism. Some kids are very significantly impacted where they may have fairly severe social communication problems, repetitive behaviors, things like that. And other kids are very mildly impacted. They maybe are a little quirky in how they interact with people and have very specific interests that they like to talk about.
So let's talk a little bit about the assessment and the diagnosis.
So the American Academy of Pediatrics really recommends that we screen for autism anywhere between 18 and 24 months. When an MChat, which is one of these tools that a pediatrician uses, maybe screens positive, then a pediatrician will typically refer to a clinic or a psychologist or a specialized physician at that point. And that evaluation is typically a little bit more extensive. We may get play-based observations. We may do a little bit of a medical history as well, that type of stuff.
Mm-hmm. So after there is a diagnosis, what are your recommendations to parents and to families as a whole?
So really the rule of thumb is intervene early and often. So we want to make sure that kids are getting into a good school program. We want to make sure that they're receiving speech therapy if they're exhibiting any speech delays, maybe occupational therapy if they're exhibiting any sensory delays, and typically some type of behavioral therapy to help with their social communication skills, that type of stuff.
Maybe you do not have a child with autism or know anyone. What are some really important things to keep in mind?
So kids with autism can have as good a quality of life as anybody else. Maybe they're a little quirky, maybe they look at the world a little bit different, but these kids are kids who are fun. They like to have relationships at times. They like to do a lot of the same things that other kids without autism like to do as well.
Okay, and there you go on that video. And that was some health and science lesson for you today. And that does it for this afternoon edition of the Riley King Newscast, right here on the Riley King Network. Thank you for joining us this afternoon. I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.